6:24 now. The U.S. Secretary of Health, Education, and Welfare wants to end federal recommendations that pregnant women get the COVID-19 vaccine. Until now, the CDC has advised expectant mothers to get vaccinated to protect themselves and their babies.
That's right. Robert F. Kennedy Jr. says that he wants to change that. Carmen Brown spoke to a doctor who warns this change could bring new risks and costs for pregnant women.
For years, the CDC has recommended that pregnant women get the COVID-19 vaccine. They've cited strong evidence that it reduces the risk of severe illness and complications for both mom and baby, but that guidance may change soon. Dr. Jennifer Hoffman with Mercer School of Medicine says for pregnant women, COVID's risks are real.
So your own immune system, as part of kind of accommodating the baby, isn't as able to fight off infection. So pregnant women in general are more prone to different kinds of infections.
Hoffman says pregnancy, especially in the second and third trimesters, naturally suppresses the immune system.
So all the things that put you at increased risk for a bad case of COVID when you're not pregnant are also risk factors for getting a bad case when you are pregnant. But probably the biggest risk factor is being unvaccinated.
She says COVID-19 infection during pregnancy can also increase health complications for the baby.
So it does increase the risk, at least for prematurity and also for stillbirth and what we call neonatal death, death in the first, month or so of life.
Dr. Hoffman says the vaccine helps protect both mother and child. She's a mom of 3 who recently gave birth just over a year ago and says she got vaccinated in her second trimester.
I got vaccinated in the fall, which was my second trimester. And unfortunately, then I got COVID anyway a couple of months later, which, can happen, but I didn't have a severe course. And my daughter is fine.
As of last month, just over 14% of pregnant women in the U.S. have gotten the 2024 and 2025 COVID vaccine. Hoffman says if the CDC no longer recommends the shot, that number could decrease, and insurance companies may stop covering the vaccine. In Macon, Carmen Brown, 13 WMAZ News.
Now, Dr. Hoffman says that if you have any questions about the COVID-19 vaccine, it's important to speak with your healthcare provider.